It is just a huge honor for me today to be podcast interviewing Dr. Sascha A. Jovanovic, DDS, MS, periodontist, founder of gIDE Dental Implant Center. I've been trying to get him on the show for 4 years, and this is going to be a big treat. He is considered one of the founders of guided bone regeneration, GBR. He was formerly trained in perio at UCLA School of Dentistry and Implant Dentistry at Loma Linda University and Prosthodontics at University of Aachen, Germany, and holds a Master's of Science degree in oral biology from UCLA. He restricts his clinical work to dental implant therapy and bone and soft tissue reconstruction, and is founder and academic chairman of the gIDE Institute and assistant professor at Loma Linda University. He is the past president of the European Association for Osseointegration and a past board member of the Osseointegration Foundation. He is an honorary member of the South African Society of Periodontology, was the program chair of the EAO 2000 Scientific Congress, as well as an award recipient from the American Academy of Periodontology, the California Society of Periodontitis, and the German Implant Society, DGI. Dr. Jovanovic's clinical research emphasizes aesthetic management in dental implant therapy and bone and soft tissue reconstruction techniques. His applied research focuses on bone regeneration with different bone graft materials, growth factors, and barrier membranes, as well as the biology of soft tissues around teeth and implants. He lectures extensively worldwide and has published over 65 articles and book chapters and one textbook titled Color Atlas of Implantology, which is translated in 8 languages. He is the editor-in-chief of the gIDE academic curriculum, is on several editorial boards for scientific journals, and presents and teaches his implant protocols globally. My gosh, you are just the legend of implant legends. Thank you so much for coming on the show. My first question I want to ask you is, I could understand before the internet if there was a lot of differences in how they practice in different countries around the world, South Africa to Yugoslavia to Germany. But now with the internet, would you say that the world is kind of averaging toward the median, and that do you see the globe kind of practicing a lot more in one way than before?
Yeah, Howard, thank you, first of all. Wonderful to be here on your show, and it looks like a real show. It doesn't look like a dental podcast. This is a real show. This is energy. This has creativity. So I'm really proud to be here and to meet you here with all your network. To your question, I have seen, of course, the world always a little bit with a global approach. And it was part of my education because I grew up in Europe, Southern Europe, and then Northern Europe. And then I moved to the U.S. for postgraduate education. And I just fell in love with the whole lifestyle and academic high standards in California. And then from there, I just kind of saw that wow, dentistry is a great field, which actually truly is, as you say, similar in so many parts of the world. So you can go today to, of course, the U.S. You have very high quality work. You can go to Italy, or you can go to Croatia, or you can go to Australia, you can go to Japan, and you always find these dentists who deliver an amazing amount of quality and consistency. And that's, of course, the beauty, that when you're teaching, that you speak the same language from a dental standpoint, from an excellence standpoint. Of course, they speak different languages. I do not speak, for example, Japanese. They do need to translate into English. But yeah, you can globally communicate today, either online in virtual classrooms or by traveling in the periods when we were still traveling extensively.
That is interesting. I think it's funny how my favorite Italian restaurant, they're actually from Croatia, and I've lectured in Italy and Croatia, and it's kind of the same food. But they said when they came to America, no one knows Croatian. So they advertise Italian, and everybody says it's the best Italian food in Croatia. But the wife is from Croatia and the husband's from Slovenia. Where exactly were you born?
I was born
old Yugoslavia.
Yeah, I was born in a country that doesn't exist anymore. It's always a lot of fun when I tell this to my kids, which was today would be Serbia. And then my mom, she's from Croatia, from Dubrovnik, the southern tip of Croatia, just on the border with Montenegro. Both beautiful places, very different. because one is more land inwards and the other one is more like absolutely coastline. So it's a nice little difference on a very small, kind of territory.
Now, my next question is really dental, but I got to throw it in. There was an incredibly amazing, great lab in San Francisco owned from two boys from over there, and they eventually sold that big lab and then went back there and built a resort. Do you know who I'm talking about?
No.
Oh my gosh! What was the big LVI lab out of San Francisco? Bill Dickerson used it a lot back in the day. It was that big lab in San Francisco. Do you remember the name of it? Yeah.
No.
Yeah, but anyway, they went back there. I remembered I was lecturing in Albania. I drove to the coast, and I was looking at the prices of how low the prices were, and I was telling all these dentists, I said, your children, this is going to be worth millions of dollars an acre, because all you got to do is cross the Adriatic Sea, and everything that in Italy that touches the water's too expensive to buy. And I thought the most beautiful side of the Adriatic Sea was the Croatian, Albania, all the way down to Greece, less developed, just gorgeous. I just love that country. But my question specifically was, when I was asking about is dentistry practice around the world, it seems to me the Germans have better laboratory technology. And when I was in Hong Kong, they only have one dental school, and their dental student class was like, I don't know, like 60, but their dental laboratory school was like 120. And then when I was talking to the head of one of the dental labs there, he was saying that he couldn't figure out why America dropped all their Crown and Bridge schools and started hygiene schools. And, we need hygienists, and now they're talking about dental therapists. But do you think that seeing German lab technicians, Japanese lab technicians, Hong Kong's only school, they take the lab side more serious than the dental side. Do you think that is kind of the weak part of America? Is that our Achilles heel, that we didn't treat? I mean, we don't even treat lab techs as serious as we do dental hygienists.
Right. Yeah, I think practicing in California now for, let's say, almost 30 years. So let's say 25 plus years, if I exclude my pure postgraduate education at UCLA and at Loma Linda. I think that there's a really missing link there. And unfortunately, I think you hit really the nail there, because I'm living in Los Angeles on the west side. And when you look at most of the high quality work really comes from laboratories which are run either by Japanese, they're run by Germans, they're run by some kind high-end Swiss guy, et cetera, et cetera. So it's or it could be some other ethnicity. And so the U.S. really, I think, needs to think, as we all know, that lab is kind the thing. If I look at my specialty, which is implants, that kind if you don't work with a precise lab, if you don't work today, of course, with a digital lab, it's kind of really making implant therapy less successful. So I definitely would want to see something in aesthetic dentistry more focused on high quality. Something more in of course a fixed pros, some of these milling type of works. It was funny, when I came to UCLA for the first time, I came from Germany. I was working at the university there, and I was trying to do the milling jobs that I got accustomed to in Germany, and nobody was able to do them in LA. So there was just no way, and we were still doing removable partial dentures. So I think that there's an opportunity there for the practice and or for the lab technician to really do something at a much higher level.
So are you kind of like the father of guided bone regeneration? Or, I mean, I whenever I think of GBR, I always think of you. And I don't know, you remember that. We're the same age, but when I was getting my FAGD, my MAGD, I got my diplomat in the International Congress of Oral Implantology. I've seen you lecture several times. Thank you for that. Why do I associate GBR with you more than our GTR, guided tissue regeneration? Is that you, or?
I don't know, Howard, it's hard. One of the beauties, of course, that we have, and you have and I have, we've been around for a little while. And I was lucky enough, of course, to be at the beginning of specialty education and learning about implants like in the late 80s. And very quickly, as when you start a new field with good people, you have some good mentors, you have some great colleagues where you have you push each other, you inspire each other. And the one thing which of course was missing right away with implants and implant placement was that we didn't have sufficient bone foundation or jawbone to place an implant optimally. And that's why in those early days implants would come out in all different corners and edges, etc. They were placed too deep, they were placed too lingual, too buccal, etc. But we learned really quickly, if we have a consistent approach to bone grafting, this actually can become something where we can control the implant placement. So at that time, I was around in Europe. It was actually still starting the gutted tissue regeneration out of Scandinavia. And the company Gore-Tex came around and they started to show us all this material, which we were kind of looking at in perio. And then we said, you know what, that material could actually work in bone much better than around perio, because in bone, we can cover it with a flap, have primary wound closure, and the biological principles can be protected. So it took me out from there. From there, I went to UCLA. Then I did a whole slur of experimental research and patient clinical documentations. And then I saw really, wow, we cannot grow just bone a little bit in an extraction socket. We can grow outside of the bony envelope. And then boom, then came the next thing, vertically, something which we could have never done before. When you think about aesthetic dentistry, to grow the gingival margin in such a way that it's really consistent. So that's how it started, and from there on, I just continued always being super into the bone graft materials, the filler materials, now the growth factors. It all makes the patient's life, of course, easier. It's less invasive. It makes the surgeon's work so much more consistent. It's not getting cheaper. That's the only problem, because all these materials cost money. But it's definitely adding us, the beauty of controlled implant placement.
You can always see how far along someone is on their journey by their questions, obviously, but the majority of the viewers of podcasts are 30 and under. Everyone who sends me an email, howard@dentaltown.com, they're usually 30 and under. A quarter of them are still in dental school. Their first question is always going to be, are you implant agnostic, or do you see research? Well, first tell them about your gIDE Dental, because the question is going to lead to, is gIDE Dental implant agnostic, or do you really see some features in certain implant systems that make your quality more consistent? So first start with your journal. When did gIDE Dental pop up, and
Yeah, so I can tell you this kind of as an interesting background. So when I started to teach a lot, and you probably have seen that as well, and that's maybe one of the reasons we both like this online platform and the outreach to dentists all over, is when you teach, it's really just kind of a moment in time that you reach somebody. And then that person might be stimulated, might be inspired. But, as the dentist goes back to their office, they go back again into, let's say, their old tricks or their bad habits. So, and it's kind of the same thing. So it's the continuous learning that really makes somebody better, and with the focus and the discipline, etc. So when I kind of had a good round of education around the world for many years, and technology online became available, in 2004, I started to do my first webinars. So that's 16 years ago. And then we started to say, okay, this works. We can connect Japan with the US, with Australia, with Europe. And time zones, of course, are an issue. But the enthusiastic dentist will wake up at any time. They're really ready to go. And that's how we then started to become more consistent with organizing online educational programs at that time. So we're now 15 plus years into, developing, into teaching, into supporting dentists in the US and around the world with specialty dentistry.
So they're probably thinking in school that they're not going to have to learn any of this because everything you teach isn't AI and robots going to just replace me and you, and you're just going to be sitting there on your Nintendo game thing, and the AI is going to do everything, and you just, will we even have to push any buttons on our Nintendo when we're placing implants? And how many years will it be before robots and like your friend Kyle Stanley, and your friends over at Pearl? I mean, is AI coming to gIDE?
We're definitely, I would say, open to the idea. Kyle has been a friend and an associate early on, and now, of course, developed into his own mentor being, so which is great to see. We have to also be honest, in dentistry, as much advanced technology as we see, it takes time to adjust to that. So let's go a little bit one step back to guided surgery and software planning. Still you're looking at today that there's probably a very few, if you look at your large number who are watching at this moment, it'd be just fun to see a statistics, how many of those who are placing implants are actually placing the implant freehand or actually are placing it guided surgery. So it takes time. So I can see that guided surgery will be part of our field as it is already today. But the whole artificial intelligence and robotic, that's kind of a tougher one because we have such a specialized situation, especially when you think about the aesthetic region. It's a science which is mixed with an art. So I believe that everything we do, which is of course, planning, diagnostics, software planning, guided surgery, artificial intelligence makes the clinician better because you're getting more complete view of everything. Does it replace? Absolutely not. It cannot. It's just too specialized.
When I break up the world, it's obvious that countries like Korea and Germany and Brazil, the average general dentist, 3 out of 4 will place an implant this month. And then when you come to the United States, that number's cut in half. I mean, some say it's down to only a quarter. Is that the way you see Korea, Germany, and Brazil? 3 out of 4 will surgically place one root form implant this month, and only 1 out of 4 in America. Would you agree with those numbers?
Yeah, I don't know what the exact numbers are, but I do agree with you, that there's a much lower number. And I have as I have a global perspective, and I've worked with most of these countries, I can tell you one of the biggest things is, of course, always time. The US market, of course, has had to deal with a heavily specialist controlled market. So the general dentist was not supposed to do surgery. The general dentist was not supposed to do implants. The general dentist was not supposed to do periodontal surgery because there's always a specialist close by. So, of course, the dental boards were looking at that too and saying, okay, if the general dentist cannot give the same service like a specialist, then, the general dentist probably shouldn't do it. But now we know with and I train so many specialists and so many general dentists, it's really not the specialist who controls the end result. It's really the individual. So I've met so many of my former students who became absolute dental experts in periodontal plastic surgery. I just had 2 guys, because you mentioned Brazil, just finish a book on periodontal microsurgery, which is absolutely stunning what they do on periodontal plastic surgery. I've had so many dentists who trained with me, become implant experts, and they're general dentists. So I never put a limit on that. But the general dentist in the US now has to make a very big shift. And that is, they have to put the effort and they have to put the time into being trained correctly. And training doesn't mean like by a company. Training doesn't mean by like, a quick 1-2 day weekend course. No, training is, like a sports academy. If you want to become better and you want to be the best you can be, or you want to become a champion, this is consistent, like, improving and training and doing the cases, falling down, getting up, and like, it's going to be like this curve going up and down until you get there. And none of us, like you, me, none of us have done this overnight. We we grew with time. So
Well,
I strongly believe that the general dentists in the US will do it. It will just take time. Can they do it? Absolutely.
well, actually, the last time I went to the gym, my trainer said, "You're too perfect." He goes, "You're retired. You'll never have to train again. No more work." When we look at the specialties, oral surgeons, their average income is $448. Periodontist is $330. Endodontist is $307. Pediatric dentistry is $304. And the general dentist, the average dental specialist is $320. Average general dentist is $197. And what confuses me is that you go to 1900 when healthcare was 1% of the GDP, there were no specialists. A century later at 2000, it was 14% of the GDP, and the MDs had 58 specialties. We have 9. Now it's 2020. Healthcare's up to 17 trillion. The ADA added some more specialties. And yet, so you see the line is going purely specialization. Yet you see all these general dentists that say, oh man, I'm going to master Invisalign and implants and endo and silver diamine fluoride and cosmetic dentistry. And they're just going back in time. I mean, are we going back to 1900 where one doctor's going to fix your broken leg, deliver your baby, and do your root canal too? What would you tell specifically to the graduating class of 2020 who has so bright-eyed and bushy-tailed, they think they're going to master everything? Are they going to master everything? Or if they're going to say, I want to follow Sascha to the gIDE Institute, I got to give something up. Do I give up pediatric dentistry? That'd be, I mean, if I had to do pediatric dentistry, I'd be working at Taco Bell. I'd take third shift at Taco Bell any day over pediatric dentistry. But can they be a jack of all trades, or are they going to have to focus?
No, so I think you're on target there. So you cannot be a jack of all trades. It's impossible. But you can become, as a general dentist, when you come out of school, you can first of course get more rounded, get more confidence with normal general dentistry, and then you can say, when you start to know a little bit more, what's your affinity? What's your comfort level? What's your confidence? Where does it draw you? First of all, does it draw you to surgery? Does it draw you to non-surgery? Does it draw you to adults? Does it draw you to, as you say, pediatrics? Then you can start to focus a little bit, and you can say, oh, okay, now I know. For example, I really love perio and implant. So I really love fixed pros and aesthetic dentistry. And then, I mean, it's unbelievable if you look at the opportunities there are today, let's say, to train. We have, for example, now online master classes in fixed prosthodontics. We're being trained by a couple of Italian experts. We have, of course, our implant surgical, if you like that, discipline. So I think, the general dentist has to say one thing: I can't be jack of all trades. That's impossible. But I can become what I call a general dentist with a star. And that's a beauty, because now your patient can be with you in more than just this kind of average dentistry.
So you're a periodontist, and whenever I meet a periodontist, it seems like if they're urban, they're kind of competing with oral surgeons. But when I look at all the specialties, I think perio was turned upside down the most. I mean, when I got out of school in 87, what year did you get out of dental school?
86.
86. So when I got out, it was periodontist was, 4 quadrants, root plane, curettage, all kinds of gum surgeries, maintenance, furcation involvements, all that stuff. And then I wasn't even out of school 5 or 10 years, and all of a sudden everybody thought, the best way to cure perio is with forceps, pull that tooth and place titanium. And that was the big rage for about a decade. And now, and then they started seeing that that wasn't a cure-all, that in fact implants got periodontal disease too. And now it kind of seems it's gone full circle. And now I'm seeing a rebirth of 30 years ago, where now the periodontist is far more interested in trying to save the tooth than to pull it out and place titanium. Do you see that circle? Have you seen that circle in the same 30 years?
Yeah, I agree with you. Like, I would say, like, I agree 50% with you with that statement. And I'll put it like this in this context. What do I agree with? I agree with it if the candidate, so the patient, is obviously not a good patient for implants. So it's one, is patient driven. Number two, it's like doctor driven, because as I said, like, some of these specialties or disciplines are really tough. Implants is tough to grow bone, to make sure that you can place the implants in an optimal position, that you don't create like a condition which has bone loss, and to have good gum around it, like, that the gum is really like a seal that can protect that implant for like 30 years. I'm fortunate now to have patients like 20, 25, 30 years almost who are coming back to see me. And it's beautiful to see how keratinized gingiva and a solid bone foundation. I mean, there's no problem with that implant to go on for, like, I say to my patients now, once they're passing that level, you're going to see this as a lifetime. So if you have the right patient, you could do it. If you have the right doctor who can do it, you could do it. If you use the right materials, you can do it. But that doesn't always come together. That patient might be completely uncompliant. I have been, like in LA patients, but they're so uncompliant. I wouldn't even think in 100 years to place implants on them. Then I have like patients where I think I can't really deliver what I want at the highest level, as a doctor. So it's not a good implant case. And then of course, maybe, they have medical problems. So you have to pick and choose the case. But I have no hesitation to tell patients, if I feel that they're a good candidate, I can deliver a good job for them, to say, hey, an implant is as good as a tooth.
So, we all know that if you had some health issue, uncontrolled diabetes or whatever, you wouldn't be a candidate. But it seems like I personally know controversies inside of oral surgery offices and periodontal offices in my backyard where the older doctor will place an implant on a smoker, pack-a-day smoker, and the younger doctors won't. Where do you weigh in on that?
Yeah, I mean, I'm pretty heavy on medically stable patients. So again, the U.S. market is tough because, I've practiced I've had licenses in many different continents just because of my teachings. And it's interesting to see how, some areas there's just like a lot of smokers. Let's say Eastern Europe, there's a lot of smokers, but they're medically very stable. So like, it's like they don't have any other issues. It's just like more like of an social traditional habit, although it's like luckily decreasing. But if you look at the California, patient, that's sometimes like a list of medication. It just doesn't finish. It's like, I got to take my time to look at that. So I think medical is very important. Smoking is part of it. I also want to tell you another thing, which I consider to be really important for dentistry, and especially for implants, is mental. So many of our patients are kind of really not mentally stable from a standpoint of following up instructions. They question us on many things. I've had patients like who jump around from doctor to doctor to doctor, and they come to my office. They've been to 6 different doctors to treat them with like 6 different implants, and I go like, where is your trust? It's a teamwork. So the patient is with the doctor. So I think medical is important, always very crucial, but mental for me is also very important.
So, I mean, we started off as Homo sapiens, and then we killed off all the other Homo Neanderthals and all that. So now we're just down to sapiens. It kind of confused me when people call us Homo sapiens. I'm like, is there another Homo species I'm not aware of? I'm pretty sure you killed them all. But to me, it looks like you couldn't have got here if you were trusting. To me, the lack of trust kind of is natural. I mean, you look at a cat walking through the jungle. He looks like he's ready to be attacked at any minute. But it seems like some people are far more closer to sapien than human. And so that's kind of where we're at 5,000 years after the pyramids. I think it'll be probably 5,000 more years before we all kind of think like humans instead of thinking in those crazy ways. But I love the way you said that about smoking. Carl Misch used to place some on smokers, and his brother Craig wouldn't. But you succinctly explained it. Are they stable? Because you're right about smoking. I mean, like when you go to in America, you have the smoking section outside on the patio and the non-smoking inside. In China, you have the smoking section and then the chain smoking section, and they place implants. So I really love that clarity. Is basically, are they medically stable or not? Another problem I have when I talk to group practices is group practices are funny because there's a lot of crazy human stuff in them. Like, for instance, when you have a group practice and you have 4 dentists, you can't even get 4 dentists to agree on the same bonding agent, the same glove. I mean, it's hard to get them on anything. And in some of these periodontal offices and oral surgery offices, they have half a dozen systems. At the gIDE Institute, how many systems would you need to do all the case? I know you do complex anterior aesthetics, but to be able to do everything, every case that you treat, how many implant systems would you need?
I mean, today I would say, like, if you want to choose only one system, that's enough. So, of course, like, it needs to be a system which is, again, like, shown and proven its track record. So that means some good solid research behind it, some good solid long-term clinical documentation, and not just like always bringing, something new because that will sell again. No. I mean, it's always funny for me, like when I get like in my office, like a new system being presented as the newest thing and the best thing. And then I ask them, okay, where's the backup? All these things that you're telling me, where's the research backup and where's the clinical documentation backup? They say, yeah, we're working on that. I say, okay, well, then why didn't you come and see me? And as soon as you have some more evidence, and then we can talk again, because of course I'm always interested to learn. And the funniest thing is always, like, as I'm also in a position of conducting research and loving research, I sometimes say to the companies, okay, you know what, this looks really interesting to me, but I cannot place this on my patient. This is like not something which is proven. There's no proven track record. So here's what we can do. We can do like, a 20 patient plus study, like clinical study, and we'll follow it up for you for, like, let's say a good 3-year plus. And this is what's going to cost you to do this study. And it's just like normal work we do in practice. And then these companies, they just disappear because they have no interest whatsoever to do that. They just want to, like, give you something new, make it sound the best. And then, like, probably like they say the doctor on the corner of the street, which is using it already. And that's your reason to buy it. So that's not good. But the good ones, I think one system is plenty. You don't have to make a confusion.
And a big complaint I get is not holding people's feet to the fire. She's 25. She just graduated from dental school. She wants to be just like you when she grows up, and she's only going to buy one system. What system would you tell her to buy?
I'm not going to mention names because I think it's kind of incorrect for me to do that. But, like, I would go for, like, what I say a premium company. So a premium company is probably going to be a company which has already, like, been around for a long time and has shown really, really a consistent amount of research output, a consistent amount of long-term clinical proof. And probably, like, there's, like, on the marketplace, there's maybe like less than 5 that you can really mention to think like this. And maybe there's only like...
Well, then name all 5. I mean, Noble Biocare would have to be there. I'm guessing Strawman. I'm thinking. Tell me if I'm wrong. BioHorizons. Um, did I get the first three right?
I think you're absolutely in the right direction. Yes.
All right, so I need two more names. What,
I'll give you another one I've liked always, Astra. I've never really used it, but I liked Astra.
And that's AstraZeneca from Dentsply Sirona, right?
Right. Mm-hmm.
Okay.
So
and,
those are
that's
the
four.
older ones.
Come on, no, you got to give me one more.
I think like another one which I've liked for many years, also not used, was 3i Biomed.
And who did that get bought up by? That got bought up by my Zeneca. No, not AstraZeneca. What's the one? Zimmer.
Could be, yeah, could be. I
they got bought up by Zimmer,
right?
And that one is I personally think they're shopping it for sale right now because I don't know, I've just seen too many variables where in my opinion I think that one's up for sell. So you gave
there's
me
one, and Howard, there's one more thing I just want to add to these. Let's say 5. Of course, like that could easily be like 6 or 7. That's fine. There's one more thing. We just focused on implants because they have really good implant systems. Some of these companies, and specifically the first two that you mentioned, Novo Biocare and Straumann. I do want to always tell dentists, and I do not support that in my own training programs. Don't refer the implant restorative work to a laboratory technician and allow them to make the decision what they put on top of it with an abutment. Because you, as the restorative dentist, together with the surgical dentist, which could be one person, you're the one who is responsible to cross that gingival cuff with an ideally should be the same system as the implant is. So don't go for third party, possibly lower cost or easier made, because all these labs today, they all want to do milling and scanning and etc. And they're often over contoured. That gingival part is like over contoured, puts a lot of stress on the soft tissue, and then you get recession and bone loss. So as a restorative dentist, if you don't place implants, that's fine. You trust somebody to work with you. But then when you take over restorative, you're not just responsible for the tooth. You're not just responsible for the occlusion, the shape, the color, etc. You're responsible for what is the connection between the implant and the tooth, so the abutment. And that needs to come from the same company or something which is approved by the company that you choose to use the implant from.
Okay, so Zoom, their stock has gone from $50 to $260. So, it's gonna fivefold. Does that mean if someone goes to gIDE Dental, gIDE dental.com, where you have 450 implant lectures, they could do this all virtual and never have to risk catching the corona from the man himself? I mean, if I was going to catch the disease, I'd rather be in California having fun. Where is your gIDE center? It's in Los Angeles, right?
Yeah, it's in Santa Monica. It's the west side of Los Angeles.
Okay, well, I'd rather catch corona there. But the question back to Zoom, does Zoom's price going from 50 to 250 validate that they could literally become an implantologist online with 450 lectures and never have to see Sascha over the shoulder?
Well, I think you can do a tremendous amount in dentistry online, because as you can see, I mean, you and me, we're communicating right now in a very interactive way. So it's very possible. I mean, we do now office hours 2 times per week for our students, and they present their cases. We have one-on-one treatment planning, for example. You can present a case to me, and then we just interact like you would present a case now to me. And so all that is possible. The one thing which, of course, is missing, and that is kind of, the hands-on experience, because as a dentist, we need to do the hands-on, but we're figuring now also out that you can do some hands-on just in your own house or office, and then just have a camera, which could be as simple as an iPhone, recording you, and then the other person, myself or somebody else, can watch this. So it's, the virtual reality is becoming closer and closer. So I think you could do a lot online. Can you do it 100%? No. I would prefer you to also, of course, have some hands-on experience, but to get you in the right direction, to be the right person, to understand the mindset of how do I become an expert and not just stay an average dentist. So, go deeper into it. All that we can do online. There should be absolutely no problem.
Okay, now I'm going to propose a marketing idea to you. And feel free to tell me I'm dumber than a rock because my four boys do it daily. But the value of your website is amazing. I mean, it's $395 a year, and you have over 425 cases. If you're not a member, you give them 2 free pre-selected lectures on demand. You should put those courses on Dentaltown. We put up 400 courses. They've been viewed over 1 million times, but it would just turn on a bunch of kids to you, and then you'd say, oh, did you like this class? Well, you can get 425. I mean, if you're giving away 2 free ones, you ought to put those on Dentaltown, because I'm always going to come back to this, to the kids. And I know that you start seeing in these dental schools where they just like Invisalign and bleaching and bonding, and I'm sorry, I don't even know that that's a real doc. The specialty that I look at is public health. And you're in a community, and someone comes in with a toothache, an abscess, an infection, and you say, I can't pull a tooth, I can't extract a tooth. Well, you're not helping the country. I mean, could you imagine breaking a leg and showing up at the hospital and they go, oh, I'm sorry, we don't do legs. You're going to need to go to the other hospital. It's like, dude, you're a hospital. You'll take them with a heart attack, a car wreck, a gunshot. And the dental offices that are doing the best, they always can get people out of pain. A bread and butter dental office, whenever you see a dental office collecting $1 million, docs taking home 250, they're doing 7 simple root canals a month, they're doing simple extractions is a must, and then they fill it in with basic crown and bridge fillings and treated kids. But if you want to be a doctor who just does bleaching, bonding, and Invisalign, I mean, I don't get it. I mean, your town needs someone to get you out of trouble, and the blood and guts. Then I'm going to come back to this. Look at blood and guts. The average oral surgeon makes $448. When they come out of school and they come to Arizona, they get their base pay is $300. $300's their base pay. Plus, or versus 40% of production. Periodontist $330, endo $307. The people are in pain. So if you want to be a bleaching, bonding, Invisalign person, I mean, and you could always tell who they are by their endo. They always, they always obturate to within a 0.5 millimeter of the apex. A real blood and guts doctor is an apical barbarian that blows a puff of sealer at the apex. I mean, they're just surgeons from their head to their toe. So I want them to learn implantology and extractions. Do you agree or disagree with this? I know dentists who can pull out a semi-impacted wisdom tooth, but are afraid to place an implant on a first molar. And I think, well, if you can pull a wisdom tooth, how could you pull a wisdom tooth and not be able to place an implant?
Yeah. Okay, so this is an interesting one. Just going to tie in to the education part. So I do have an online masterclass, which is dealing with extraction sockets, just with socket preservation, but primarily focused on implant placement. So remember again that when you're looking at extractions, you have a lot of small details which are going into place just to remove that tooth. And most dentists are not so preoccupied with the bony part. I mean, they get the tooth out, they maybe take some of the bone out, and they close it up. We who are now focused on implant dentistry and placing an implant, we're all about preserving the facial buccal bone plate. So, for example, I use a piezo surgery to cut, the bone really in the periodontal ligament space really carefully, so I don't have any risk, or I lower the risk as much as I can. I section the tooth and then I go to the implant. So you got to move your head again, like, from extraction. Really, okay, that's the goal. Of course, the patient is in pain, or the tooth is failing, or there's a fracture, or there's a deep decay, or whatever. But the next step right away is like, how do I preserve the bone, which I need to regenerate bone to place an implant safely? So it's not always that the person who knows how to take a wisdom tooth out also knows how to place an implant, because they got to shift kind of that traumatic idea of just yanking it out of there, or like carefully luxating it out of there, or surgically removing some bone and then taking it out, to actually saying, okay, my goal is to remove that tooth as atraumatic as possible. Why? Because I need to preserve bone for my implant. I need to preserve bone so I can grow more bone. So it's a little bit a different mindset. And once you have that mindset, then you could do it.
I think what you're doing for dentistry is so fantastic, and I don't think they should learn implants at a Holiday Inn seminar 1 week. It's a very long-term process. I'm really excited about this, and I really think it'd be really great to put, if you're giving away courses for free, you should put one on Dental Town. It'll be amazing marketing, and I want to be pushing them towards the right direction, and keeping them avoid going the wrong direction. So the bottom line, I just want to get to, you said, when I said, do you need to buy a $135,000 laser to treat Lanap? And you said, well, just focus on the three things. And the three things were proper patient selection and proper implant, what would you call it? Implant company, or proper?
Yeah, basically, I always say the three things. They're like always patient selection, doctor quality. So have your training and education and experience and confidence ready. And third one is like have the good products to support this, to support the patient and to support you. Don't go for like just because the bone graft material is cheap, go for the cheap bone graft. Understand what does that bone graft material do, and then care less about the cost, because in the end, everything we buy in healthcare is going to be expensive anyway.
Right, and there's always the price of the initial cost versus the long cost. I mean, there's so many things in economics where if you just would have bought the more expensive air conditioner, it would have been more expensive up front, but lasted twice as long. And
right.
they always look at initial cost and not total cost. And the government's the worst. I mean, remember when John Glenn was the first American to orbit the Earth? They said, what were you thinking about while you're up there? And he was thinking, I was in a spaceship built by the lowest bidder. and it scared the hell out of me, because they do it with roads. People say, why did it take them 6 months to build that road? Well, you sub it out to the lowest bidder, because that's America. America is money's the answer. What's the question? You're running out of time. I could listen to you for 40 days, 40 nights. What were you hoping we'd talk about in the final few minutes that we haven't talked about yet?
I want to touch a little bit on the let's say the young dentist, and the young dentist doesn't mean at all age, but the young dentist means the person who is young enough in their mind and young enough in their body. So having the right energy to say, you know what, I've done something for a long time, or I've not learned enough, and I know I'm inexperienced, but I want to do the right thing. And I think that's the key for anybody who has been practicing for 20 or 25 years, or like anybody who's been practicing a few years, is to just make that mindset is like, hey, dentistry and dental school is just was phase one. And it just gets me going. Now I have to go for the next thing. And how do I want to be successful to become a general dentist with a star, or to become a specialist if they choose so? How can it's all in the mind. Because if you think about it, like every dentist who came out of school has a reasonable level of like manual dexterity and knows a little bit, some of course are better than others, but they know enough. But the rest is the mindset. So change your mindset, as you say, don't be like the lowest bidder, be quality oriented, because that's how patients come back. And they'll come back, they'll remember you, with the mobile society, they're going to say, damn, you know, that female doctor that I had, that female dentist or that male dentist, you know, that was just unbelievable. I mean, I wish I would still be with him. They're going to call you. Then they're going to say, you know what, I live now here and here, but can I come back, or can I have today, like maybe a virtual consultation with you? And I'm happy to pay for it. Just help me out. Or do you have maybe, I get so many calls from patients around the world. I'm in Hong Kong. Which dentist should I see? I say, well, I happen to have a person who I really trust. I would go there. So I would say, like, young at mind, young in your body, don't give up on going to the highest level that you can go.
In 62 days, only 2 months away, is your annual symposium. Your 3-day symposium in Santa Monica. Does the pandemic change that? I mean, we've seen, what do you think? In 62 days, do you think that's going to be a go with a mask, or do you think that's a cancellation?
No, we have pretty much all the classroom and all the symposia here in California. We have shut them down and postponed to 21. We are lucky that, like, you know, we can do this, like, you know, that we can reschedule and to focus on other things, you know, to focus on our patients, focus on our training, focus on our programs. So, like, you know, we can do this.
So there'll be no meeting this year, so it'll be this time next year.
Exactly, yes.
And what do you think the chance is that Dentaltown might get an article or an online CE course from the man? I know he's shy and humble, but he is the founder of Guided Bone Regeneration from All My Friends. Now, maybe we're all a bunch of crazy drunk people in Phoenix, but we all believe that you're the founder of that. Love to get an online course from you or an article. Love what you're doing for dentistry. To all the young kids out there, just remember, blood and guts is worth twice the money than Invisalign and bleaching and bonding. I mean, at the end of the day, you're a doctor, and they can't sleep because their tooth is hurt, and you can't pull it or do a root canal or replace it. So you're a doctor. One person told me the other day, he said, well, you know, I just don't like blood. It's like, dude, they're called electrical engineers. How did you get all the way through dental school and you didn't like blood? I mean, there's no blood inside my iPhone. I think you picked the wrong career. But thank you so much for all that you've done for dentistry. Thank you for helping me get my MAGD back in the day. Sascha, I just think you're just an amazing man. It was very fun podcasting you. And if you've ever got something you want to say again, you got my email, my cell phone, howard@dentaltown.com. Come back anytime you want.
Okay, likewise for me, Howard. And this was a great experience for me. Like, sorry for that I was gone for a quick moment there, but so many different discussions, and you're just a wealth of numbers and statistics. So I love listening to you as well and learning from you. And I'll definitely will contribute to Dentaltown. So we'll talk more about that. Putting up a couple of, like, what I think important online classes there. So your network and your dentist members can learn from there. And then we hopefully will go from there and make dentistry better together.
All right. Have a rocking hot day, Sascha.
Thank you, Howard. Bye.
Bye-bye.